My guess is nobody has ever told you about the 20% solution under some Medicare plans. The 20% solution. Yeah, this is something that you probably need to know about, especially if you're turning 65 and looking at Medicare options. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, so what the heck is the 20% solution? Well, first off, you need to know that a lot of folks out there are pushing the Medicare alternative plans, the PPOs, the HMOs, commonly referred to as Part C or sometimes the Medicare Advantage plan. And the way they tell the story, I mean, gosh, you'd be a darn fool if you didn't take advantage of it because, well, there's no premium in a lot of cases, and there's no copays in some cases, and it's got all these extra things, bells and whistles and so forth. So, yeah, you'd be a fool not to take advantage of it. As long as you understand the 20% factor, the 20% solution that goes with these plans. Okay, yeah, a lot of your coverage, primary coverage in particular, a lot of your primary coverage has either low or no copays. This may include lab work and x-rays and stuff like that. But when it comes to the big stuff, you know, things like radiation therapy, chemotherapy, outpatient physical therapy, outpatient mental health therapy, a lot of things like that don't come with a copay. It varies by plan, but you just need to make sure that you understand that when you're looking at these plans, you need to find out, well, is some part of my coverage subject to a 20% coinsurance? And so you've got to ask. Nobody's going to tell you about it. And here's how the 20% works. If you get into a situation where you need chemotherapy, you need radiation therapy, or some of these other outpatient procedures that can be quite expensive, you're expected to pay 20% of the cost. The plan will pay the other 80%. You're expected to pay 20% of the cost, usually up to your out-of-pocket maximum. That out-of-pocket maximum could be anywhere from $5,000 to $10,000 or maybe even more, depending on your in-network or out-of-network and, you know, all kinds of fancy moves that you need to be careful of. So, when you're looking at these alternative plans, the PPOs and the HMOs, just be aware that if you have to get into a situation where you're subject to 20% coinsurance, that might be something that you want to think about before signing on the dotted line. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.